Good afternoon, one and all. So, myself, Dr. Maitri, from the Department of Pathology. So, I'll be taking four slides for this practical class. So, we'll be discussing on actinomycosis, rhinosporidiosis, granulation tissue, and TB lymph node. So, all of you should know whenever a slide comes for discussion, so the examiner can even ask the theoretical aspect. So it's not only just identifying the slide, so you should know little bit of the theoretical aspect related to the slide as well. So coming to the first slide, that is actinomycosis. So it is a slowly progressive suppurative fibrosing infection, mainly involves the jaws, thorax and abdomen. So it is caused by actinomyces species. There are various actinomyces species, but the most common is actinomyces israeli. So whenever they ask what is a positive agent of actinomycosis, the answer is actinomycosis israeli. So it's a branching filamentous gram-positive rod. The organism are usually they are commensals in the oral cavity, alimentary tract and vagina. The infection is always it is endogenous in origin and it is never through person to person contact. So there are four types of actinomycosis, that is cervicofacial, thoracic, abdominal and pelvic. The cervicofacial is most common and it's called as lumpy jaw. So in this picture I've shown the different types, that is cervicofacial, the other name for it is lumpy jaw. Then when it involves the lung, so we call it as thoracic actinomycosis. Abdominal, when it involves the ileocecal region, mainly the appendix and the cecum are involved, and pelvic actinomycosis, that is whenever there is involvement of uh, the uterus. So coming to cervicofacial actinomycosis, this is the commonest form of actinomycosis and it has good prognosis. So usually the infection enters from tonsil, or it can enter through a caries teeth, or from a periodontal disease, or following a trauma, or a trauma following a tooth extraction. So initially there is a firm swelling is formed in the lower jaw and it is called as lumpy jaw. And with the progression of the disease, this mass it breaks down and abscess and sinuses are formed. And this discharging pus contains a typical tiny yellow sulfur granules. So this is the characteristic feature of actinomycosis. So in this picture you can see there is a abscess which is involving the lower jaw. And in the second picture, you can see multiple discharging sinuses present over the anterior chest wall. The first picture is before the treatment, and in the second picture, it's slightly it is dried up and it is after the treatment. So this is the clinical presentation of actinomycosis. So basically, they present with depending on the region. If it is cervicofacial, they present as lumpy jaw, and in other areas, mainly as discharging sinuses. So coming to the thoracic actinomycosis, here mainly there is infection of the lung, and it can be because of aspiration of the organism from the oral cavity or extension of the infection from the abdominal or hepatic lesions. So in case of abdominal actinomycosis, it's more common in appendix and the cecum, and also in liver. And the infection results from swelling of the organism from an oral cavity or extension from a thoracic cavity. Then coming to the pelvic actinomycosis, here the infection in the pelvis occurs as a complication of IUCD, that is intrauterine contraceptive device. So that is when it is involves the uterine cavity, it is called as a pelvic actinomycosis. So you should remember the four types of actinomycosis. So coming to the microscopy, so how does the slide of actinomycosis look? So here this is the our slide only where I have taken the picture. This is a low power view of the slide. So you can see a eosinophilic hyaline kind of material with a radiating filament kind of structure. So this is the actinomycotic colonies. This is how they appear. So the surrounding area, you can see inflammatory cells. So I'll show you in the high part. So this is a high part view of the same. So this is the uh, actinomycotic colony, and these surrounding areas there is inflammatory cells. The inflammatory cells we are supposed to write is the neutrophils, lymphocytes and the plasma cells. Okay, so this is the chart which you all have to write in your record book. So please use HND pencil and draw a neat label diagram. And I have put up few questions at the end of each slide. So you should answer these and show it us when you come to the college. So you should know what are the types of actinomycosis, what is a causative agent of actinomycosis, what are the risk factors which is involved, and what are the different diseases which is present as discharging sinuses. Then coming to the second slide, that is the rhinosporidiosis. Here it's also infective uh, etiology. It is caused by Rhinosporidium seabrai. It's more common in India, Sri Lanka, and they present as nasal polyp. This is the life cycle of the organism. Uh, First, there is from a trophozoite, it starts. So what happens is that is the it divides within a sporangium. So this cell, it's called a sporangium. So it is a double layered cell. So within the sporangium there are multiple spores. They are also called as endospores. So they keep dividing and ultimately they rupture and they come out of it. This is the infective form of the organism. So this rhinosporidiosis, clinically it can present as nasal rhinosporidiosis or as cutaneous rhinosporidiosis. So in this picture you can see a polyp within the nasal cavity. So coming to the microscopy, this is a low power view of the slide. Here you can see many round structures. They're nothing but the sporangium, which contains the spores, and the surrounding area that you can see a lot of inflammatory cells and fibrous tissue. Okay, so this is the hyper view. You can see this is the sporangium, and you can see the wall, which is thick wall, and within the sporangium there are spores, and surrounding area, these blue structures, they are nothing but the inflammatory cells. So so this is the chart to be written in your practical record book. So you have to write a lining of the nasal cavity. So the nasal cavity is lined by pseudo-stratified ciliated columnar epithelium, and you need to write many sporangium, which is double layer, which contains spores, and surrounding area you have to write chronic inflammatory cells. And the questions to be answered are: how does rhinosporidiosis present? What is a causative agent? What diseases can present as polyps in the nose? What is rhinoscleroma? And what is Micklesby cells? Then coming to the third slide, that is granulation tissue. So granulation tissue, it is mainly involved in the process of repair. So whenever a tissue is inflamed or it is damaged, so finally it has to heal. So that process, it can lead to granulation tissue. So the granulation tissue term, it means it is granular and it is pink in appearance, the granular. Okay, so the granule, it corresponds histologically to a proliferation of new blood vessels, which is which are slightly lifted on the surface by a thin covering of the fibroblast and young collagen. So basically, there are three phases are involved in the formulation of a granulation tissue. The first phase is the phase of inflammation. The second phase is the phase of clearance, and the third phase is the formation of the granulation tissue. The first phase, that is the phase of inflammation, here what happens is that whenever there is trauma, there is blood clot at the site of injury. So there is acute inflammatory response with exudation of the plasma. Acute inflammatory cells are the neutrophils which come to the affected area, and there is exudation of the plasma, and there is exudation of neutrophils, and even the monocyte come to the picture. Then there is a phase of clearance where uh, there is combination of this proteolytic enzymes which is regulated from these inflammatory cells, and there is phagocytic activity of the macrophages which clear off all this necrotic debris and the RBCs. So this phase is called as the phase of clearance. And the third phase is the phase of ingrowth of the granulation tissue. So here there is angiogenesis, that is, there is neovascularization, means there is formation of a new blood vessels, and there is fibrogenesis, that is, there is formation of there is proliferation of fibroblast. So in your theory classes, it will be dealt in detail. So I have just covered the important theoretical aspect here. Okay, so coming to the microscopy, this is a low power view of the slide. Here you can see there are multiple blood vessels which can be seen, which has a endothelial lining. So these are the proliferating capillaries, and uh, the surrounding area you can see a lot of spindle cells. They're nothing but the fibroblast. So basically in granulation tissue there is proliferation of the blood vessels, that is, there is neovascularization and there is fibroblastic proliferation. So this is a high power view of the same. So there are multiple dilated spaces, then nothing but the proliferating capillaries with the fibroblastic proliferation. So this is the chart of the granulation tissue which has to be copied. So you need to write edematous stroma. Stroma is the surrounding area is called as the stroma. So where you have to write the proliferating uh, plump fibroblast, and you should write the proliferating capillaries, and you have to write many inflammatory cells which includes the neutrophils, lymphocytes and plasma cells. Then coming to the questions. So you should know what is a granulation tissue, what are the types of wound healing, what are the factors affecting wound healing, and what is a scar. So please answer these questions. Then coming to the fourth slide, that is the TB lymph node. So the TB, that is the tuberculosis, is caused by Mycobacterium tuberculosis. So there are two types of tuberculosis, that is the primary tuberculosis and secondary tuberculosis. So when an infection of an individual who has not been previously infected or immunized, and they are called as primary tuberculosis, that is the person is not affected previously with tuberculosis. So the main characteristic feature of a primary tuberculosis is there is a formation of Ghon's complex. So the Ghon's complex is, it has a pulmonary component, it has a lymphatic vessel component, it has a lymph node component. Okay. So the pulmonary component, mainly it is located peripherally under a patch of a pleurisy. So it is mainly seen in the upper part of the, you can see here, this is the Ghon's focus. So it is seen in the upper part of the lower lobe. Okay, that is the pulmonary component. And there is lymphatic vessel, that is the draining lymphatics uh, will be involved, and there is lymph node component. Here mainly there is enlarged hilar. You can see in this picture there is enlarged hilar component. So this forms a Ghon's complex. That is, there is Ghon's focus. This is a Ghon focus. This is the radiating lymphatic vessel, and there is lymph node component. So basically, in tuberculosis, what happens? There is a formation of a granuloma. So what you should know, what is a granuloma and how a granuloma is formed. So whenever there is an entry of a tubercle bacilli into the body, the first cell which is gets activated is the polymorphoneutrophils, and even the macrophages come into role. Later on, by the activation of the CD4 cells, this macrophages gets activated, they get reformed to a different type of cell. They're called as epithelioid cell. So epithelioid cell, they are much more plumper, they're like slightly bigger, they're elongated. You can see here the cytoplasm is more eosinophilic, that is, they're more pinkish, and they have a elongated nuclei compared to a macrophage. So they are elongated and they have a characteristic appearance that is called a slipper shaped appearance. So these are all the important feature of a epithelioid cell. So whenever an examiner asks what is epithelioid cell, so you need to describe how is the shape of the nucleus and how is the cytoplasm and how is the shape of the cell. So basically epithelioid cell, they are activated macrophages. So this epithelioid cells, they form aggregates to form a granuloma. So, and also you can see there is proliferation of the fibroblast, and there is a lot of lymphocyte come to this aggregates, and they form a hard tubercle initially. So later on, what happens whenever when there is caseous necrosis, it's called as a soft tubercle. So this is how a granuloma is formed. So the other slides, we don't have any cross picture. So this is a cross picture of TB lymph node. So this is a specimen which is there in our practical hall. So you all can see once you come back to the college. So here you can see there are two structures, that is, which is gray white in color, and on cut section, there is necrosis, so which is classically described as caseous necrosis. So this is the gross appearance of a TB lymph node. So coming to the microscopy, so the TB lymph node, mainly you can see lot of, can you all appreciate these round structures? They're nothing but the tubercles. So that is, there is granulomas. So there is formation of the granulomas, and you can identify this as a lymph node by the presence of the lymphoid area within the background. Okay, we'll go to the high part. So this is how a granuloma looks. So this paler area, they call as caseous necrosis, and if you see closely, there is arrangement of this epithelioid cells concentrically within around the caseous necrosis, and this is the lymphoid series of cells in the background, which indicates this is a slide of a TB lymph node. So basic, the important finding here is the formation of the granuloma. So this is a hyper view. So yeah, one more thing, you can see a multinucleated gene cell, and if you appreciate, you can appreciate there is arrangement of these cells in the periphery, and they are called as Langerhans type of gene cells. So, so there is a formation of granuloma here. So this is the still more hyper view. So this is what I was telling about the multinucleated gene cells, and this is a Langerhans type of gene cell. So the nuclear arrangement is described as horseshoe shape arrangement. Okay, so these are the lymphoid series of cells. So this is the chart of the TB lymph node. So you have to write the structure of a lymph node. That is, you need to write a capsule. So you need to write you need to write a granuloma. So that is, you have to write central caseous necrosis, and there is epithelioid cells, Langerhans type of giant cells, and the lymphoid series. Okay, so this is the chart which has to be copied to your practical record. So then coming to the questions, you should know what are the types of tuberculosis, what is primary and secondary tuberculosis, what is a granuloma, what is a clinical presentation of tuberculosis, and enumerate some granulomatous diseases. So please, all of you, answer all the questions given. And for any day, for any doubts, you can mail me, that is Dr. Maitri Manjunath 2015 at gmail.com. So I thank one and all. So take care and stay safe. Thank you.